Hello. Hello. My name is Rosie. This is my sign name. Thank you so much for asking me to be present tonight. It's really wonderful to be part of such an important workshop linking with empowering and campaigning change in South Africa. Who am I? I'll introduce myself. I'm deaf. I've got a deaf family and I grew up in a deaf family as a British Sign Language user, so we use BSL for short. I grew up in England and I work as a qualified registered social worker. I did my training at university and got a degree to get that qualification a long time ago now. It was 25 years ago. And now I've focused on my PhD studies, so I'm a PhD student. I work with a research group called SORD, S-O-R-D, and that stands for Social Research of Deaf People. My training is for 6 years, so my PhD is 6 years altogether, and I'm currently in my 4th year, and I'm based at the University of Manchester, which is in the northwest of England. My area of research is specifically looking at social work with deaf people. So South Africa and the UK systems are very, well, potentially very different. I don't know, but I will give you an idea of what our system is in the UK, and then you've got the information about that, and then you can compare. In the UK, we have 4 nations. We have Ireland, Wales, Scotland, and England, and that makes up the United Kingdom, Northern Ireland, and they've each got devolved powers and their own government. So I'm going to focus on England for the presentation tonight. So we have the government present in England, and then we have more regional councils, and they are called local authorities. And there's approximately 340 throughout the UK. Those councils have their each departments as well. Okay. Would you like me to go back a little bit? I'll just repeat, I'll just go back a little bit. Okay, so the UK has 4 different nations, and they each have their 4 devolved governments with their own laws. So for this presentation tonight, I'm going to focus on England. So we have the government leading, and then we have in each area where there's over 340 different councils, or called local authorities. Within each local authority that is specific to the area where people live, they then have what's called social services, which look after people's social care needs specifically. This could be perhaps the older people's department, it could be children and families. There's a different team for physical disabilities or mental health needs. Social services covers a whole range of different departments. For myself and my work with social services, I've been working with deaf people specifically. Obviously, deaf people can have a range of communication needs. They can have a range of hearing loss. And obviously, it covers the range of, from birth through to death. It can cover any age group. Whereas myself, I focus on the work and working with deaf British Sign Language users. In the UK, there are approximately 80,000 to 120,000 British Sign Language users. In England, we have a law called the Children's Act, and that was passed in 1989. And this links with Section 47 which looks after protected children, and that can be any child at all living in the UK. There are 4 categories that this Act covers when we're looking at looking after children. So it could be sexual abuse, it could be physical abuse, it could be neglect or not being looked after properly. And the 4th aspect is emotional abuse. So those are the 4 different categories of abuse. In 2004, that law was amended to include safeguarding. So that has been for about the past 15 years that change took place. Our sign for safeguarding is protect and look after. And that's the meaning of safeguarding. It's protecting and looking after different people and different groups. There are different categories that have been added to safeguarding. Say, for example, grooming. So say if there is a child and an adult was pretending to be a child and they were trying to groom them into having a relationship, that's an example of grooming. Another aspect is cyber bullying, where maybe a horrible comment could be put on the internet, something that's really not nice and upsetting. That's another example of safeguarding. It could also be inappropriate photos being shared, perhaps something rude or naked photos, something really not nice being posted on the internet. So all of these categories have been added to the safeguarding law. And obviously the internet and how the internet and technology has changed over the last 15 years has had a big impact on those changes as well. So when we're looking at deaf children, also disabled children, they are overall at a higher risk of being abused or neglected. But our law in the UK doesn't only cover children. We also have an act that can cover vulnerable adults. And that's a law that we have in the UK here. So that could be perhaps older people or people with learning disabilities. It might be adults that need additional support through their life. And in society, we need to make sure that we safeguard them as well. So it's not just children, it's adults as well. This can cover deaf women as well, because it's looking at protecting deaf women due to gender inequality, oppression that women may face. It could also be the fact that they're deaf. It could also maybe linked with race or ethnicity. It could be their religious beliefs. So again, there are a number of reasons why this could happen. So when we're looking at safeguarding, it really means keeping people safe from harm of any age. So keeping them safe and trying to reduce any abuse and neglect and looking after their well-being. For myself, I work as a social worker, and I've been involved with court working with some deaf parents who are sign language users themselves. So I've been supporting them through the legal process if it has got to the stage of them going to court. If it would get to court, the start of the process is the fact that social services would have a concern over the parenting skills of the child. So social services would then do an assessment of the child and see how the parents are looking after the child. These cases can be very complex, so sometimes these cases have to go to court for the judge to decide whether the parents have the child living with them or whether the child is removed and is put into safety, so in other words, isn't left with their parents to look after them. There has been an increase in a number of cases happening in the UK, and particularly with children being taken away from the deaf parents. So I thought it was important to go back as part of my research and look at the assessment process. And that's what I'm doing for part of my PhD. So for my PhD, I was looking at the assessment process first because it starts with social services and whether that assessment is appropriate for deaf sign language using parents to go through that assessment. Does it take into account their linguistic needs? Does it take into account their cultural differences? So the first part of my PhD was to do a literature review. So to look for any information or any journals that had been written out there with regards to safeguarding and deaf parents. So I was looking for different books, I was looking for different journals, from any publication, from the government, from any other researchers. And I was surprised to say that there was nothing or very, very, very little. So I had a look around the world. And again, there was nothing. There was very, very little research that had been done on this. So I didn't just specify it to deafness. I thought I'd look wider. There was lots of research out there on being deaf and British Sign Language and the linguistic aspect of things, but nothing with regards to safeguarding. So I was quite surprised. I then thought I would extend my research to look for other cultural-linguistic groups, so who didn't have English as a spoken language, so they would share a different linguistic language and also a different culture too. And again, there was very, very little research, but I thought that research I would be able to compare it if I found any. So with very little research to go from, what I then had to do was to interview different professionals. And it was professionals that were linked with safeguarding issues. So other social workers or advocates who had supported deaf parents through this process. I interviewed them on a one-to-one basis and I filmed those interviews. All of those interviews were conducted in British Sign Language. It was a mixture of deaf and hearing people. They weren't all deaf, but all of the interviews happened in British Sign Language. So there were 7 different people that I interviewed all together. And that is then the data collection stage. I've just been going through all of that research and that's given me lots and lots of information to go with. And I'm hoping soon to be able to publish that data analysis. So I'm going to give you my preliminary findings today from that data analysis that I've done so far. And obviously then you can make the comparison whether things are similar in South Africa or whether they're different. In the UK, it might be that the social workers working within the children and families team are given a referral of a concern over deaf parents, and that is often the first deaf person they've ever met. So they don't know how to communicate. Some of them bring in an interpreter, which is great, but sometimes that interpreter that they bring into that assessment process hasn't got the knowledge and the background themselves to understand what the safeguarding process is. As I'm sure you can understand, there is a number of questions as part of this assessment process. So it sometimes happens that the deaf parents don't understand the questions, even if they're using an interpreter, because of the misunderstanding that's taking place. So of course, the social worker will note down the misunderstanding or the fact that the parents aren't understanding the question. It could be that they're responding in a totally different way because they're misunderstanding what's being given. And as we quite often know, it's a cultural mismatch because the different cultures between hearing people and deaf people are so different. Most of the hearing children born to deaf parents in the UK are hearing. So at home, they would communicate through the cultural nature of flashing the lights on and off. They would tap the parents to get their attention. They would communicate in British Sign Language at school. However, then when they get to, interpreter error there. When they then go into school, it's obviously a hearing environment, at which point they're then communicating through speech. And it can be a cultural identity shift for the child to then be exposed to the hearing culture within school. Sometimes if school then pick that up and see a potential behaviour change, then school can report it to social services, at which point the assessment process is then started and the parents are brought in, but there isn't always an interpreter brought into the school environment, and they are expecting the child to relay that information over the information that's being asked of the parents and the child. Obviously, it's not appropriate for the child to be relaying that information. It's a really complicated process, and they're not giving the parents the best opportunity to understand the process that's taking place. Even if they give them a copy of the written form, then it's lots of written English on there. So again, that can be misunderstood by parents. Sometimes when people grow up, they obviously have different lived experiences, different life experiences. So it depends very much on the deaf adults when they become parents, whether they have the skills and the supports to be parents themselves. Sometimes that information isn't always available, and it depends on their support network as to who they can ask for those skills to. There are different groups that social services run, which are called parenting classes, which a deaf couple could join, but it would be within a hearing group. And obviously those lived and shared experiences would be very different to a deaf person's lifestyle and a deaf person's cultural needs, because hearing people live differently than deaf people. So again, the deaf couples might then withdraw from the group, and it's not because they're not interested, but it's due to the communication difficulties that they're having. But obviously that gives a wrong message to social services as to why they're withdrawing from the group. The social services departments throughout the UK, some of them are very skilled, but some of them are less so, and that varies. They're very much dependent on which region you live in the UK. There could also be the example of the actual parent relationship between mother and father breaking down. It could be that mother doesn't want to live there anymore, wants to try and leave home, but doesn't quite know how to do that and hasn't got access to the information. It could be that the child is observing the arguments that's taking place or any potential abuse that's happening there. It could be that the father needs support. It may be the father's got anger issues or needs some form of support, and maybe they both need counselling as a couple. But again, once social services comes into that assessment, you can see how complex these assessments can be and the different conversations that need to take place. So safeguarding really does cover a whole aspect and a whole array of different things, and it needs to be covered for each and every one for deaf people. I know this isn't just unique to the UK, and I know obviously things happen in South Africa as well. But sometimes abuse happens to people because they don't realise it shouldn't be happening. And it's not until somebody says something or they have access to information where they think, oh gosh, that's happening to me now, or that happened to me in the past. Sometimes individuals don't want to share that information with other people. Sometimes they keep it to themselves, or some people, sometimes they don't know where they can share it with. There are lots of barriers in place that we know, and one of the main aspects of the research that I did is the awareness or the lack of awareness within the deaf community. What I've collated from my interviews is that the information that is there saying in the UK that they do have support networks. However, that is sometimes from regional organisations or national organisations. There's one mainstream organisation that regularly sends out information on safeguarding. So that's really good for sharing the awareness on how to keep safe. But they also make sure that they educate not only people within the community, but professionals as well. So maybe police workers or people working within healthcare, so that professionals understand how they can support people in the right way if they're going through a safeguarding issue. Obviously, we now have technology at our fingers, and social media is really helping that too. So there is a lot more information exchange taking place in British Sign Language, and hopefully other countries have the same, of it being in a visual nature in their own sign languages. But there are a lot more vlogs and a lot more videos taking place now, and that accessibility is there to make sure people know how they can keep themselves safe. In the UK, we do have support from social services, but there is not enough support. And as we've said, quite often deaf families with hearing children quite often need additional support to what a hearing family would need. So part of social services responsibility is to signpost people to other organisations to work with them as well, to give them a specialist service. It could be counselling. So it could be counselling, and the counsellor themselves has an understanding of deafness, can communicate in British Sign Language, possibly being deaf themselves, and obviously give that understanding and that counselling to deaf people. It could also be specialist mental health service as well. If a deaf person has been through specific safeguarding issues, they might feel depressed. So they might need to access therapy through the mental health service to help look after themselves and get themselves better. There are more workshops happening around the UK, and that is giving people understanding and awareness of how to improve their parenting skills as and when they become parents. So that is good that the information is being shared. You might be thinking, wow, the UK has got so many services, this is great. It's good, but it's also, we are very much working with professionals and organisations and campaigning through and through to get this equality. We very much have to campaign and ask for the information to be accessible, and also for having specialist services provided for the deaf community in the UK. Some of that has happened, and that is good, but we still need more of that to take place. When we're looking at deaf people and deaf families, obviously there's lots and lots of work to be done on the safeguarding and the processes in place. So we will continue doing that, but hopefully this gives you an idea in South Africa of what is happening in the UK, and you can take from that and learn from that. What I do think is important for any deaf community is to make sure that you keep people safe. Deaf children, deaf women, we need to make sure that the support is there. We need to make sure that that support is there. Talk to people, give people information. They might just be waiting to see somebody they can trust. It might be a friend that they're wanting to talk to, or it could be a professional, which is even better. And then obviously they can get the professional support that way. It possibly could be that you've got mainstream services that are giving support to other people in the communities. So have a chat with them, see how they can make their service accessible for deaf people, so that the deaf community can access that service as well. So I think I'm going to finish there, and I think I'm going to pass on now to Debbie, and I think she's going to present more specific to South Africa. So thank you for watching.